third year postgraduate student. Greetings and warm welcome to the sixth session of the Masterclass series on behalf of the Department of Conservative Dentistry and Endodontics, Bangalore Institute of Dental Sciences in association with ACE Karnataka. Now, due to the different time zone, the program had to be rescheduled at 2:30 p.m. today. So here we are back again. Now, before we commence today's program, I would like to invoke the blessings to the Almighty to make it a grand success. For years, endodontists have strived their best to deliver to their patients the best of the treatment. Of course, a good successful treatment, as we all know, it is a harmony of functional, anatomic, and aesthetic integrity. Aesthetics, a term that is gaining its importance with the increasing demand of the patient's promises to be the future of dentistry. Hence, it is really crucial and beneficial for us to hone our skills in this art and science alongside routine endodontics. So today, we are very happy to have a world-renowned international speaker, Dr. Jordi Manauta, amongst us, who's going to throw light on aesthetic in dentistry. So without any further ado, I hereby request our mentor, our guide, our HOD ma'am, Dr. Ramya Raghu ma'am, to invite and address the guest speaker for the day. A humble request to all the participants to mute their audio and switch off their video during the session. We would be having an interactive question and answer round in the end of the session. So kindly forward us your questions in the chat box for the speaker to solve your queries. Thank you. Over to you, ma'am.
Thank you, Ruchika. Good morning, Dr. Jordi. Namaste again. A warm welcome from all of us in India. Good afternoon, dear members of ACE Karnataka, faculty members, and postgraduate students. We are here today with bated breath and a lot of excitement and expectation for the much awaited lecture on aesthetic dentistry. On behalf of the chairman, Shri Katuri Subbarao, our directors, Dr. Swaira and Dr. Siri Krishna, our principal, Dr. Vinaya S. Pai, and the staff, Department of Conservative Dentistry and Endodontics at Bangalore Institute of Dental Sciences, I extend a very warm welcome to all of you. Thanks for staying with us patiently, for the session has been rescheduled to the afternoon of today. Today's speaker is none other than Dr. Jordi Manauta. He is the world-renowned aesthetic dentist with exceptional skill and craftsmanship. He is one of the greatest luminaries of aesthetic dentistry today, and he is acclaimed and worshipped as a true master of aesthetic dentistry. In fact, he is one of the founding architects of modern aesthetic dentistry alongside the likes of Dr. Pascal Manet and Dr. Walter Devoto. He is the author of the landmark quintessence publication book Layers, and he was extremely gracious to accept our invitation at such a short notice, and having him with us today has added tremendous value and provided a new dimension to our program. I'm sure all of us will be immensely inspired and benefited listening to his lecture today. I would like to profusely thank Dr. Ashwini Santosh, our dear friend, who was instrumental in bringing him to our program. Now, before we go ahead with this talk, a little bit about Dr. Manauta's achievements. Born in Mexico City, Dr. Jordi Manauta graduated in dentistry from the Technological University of Mexico. He pursued his master's degree in operative dentistry and aesthetic dentistry from the International University of Catalonia in Barcelona, Spain. He was trained by Dr. Miguel Thames and Dr. Walter Devoto in aesthetic dentistry, and he has developed various innovative materials and specialized instruments for aesthetic dentistry in collaboration with international companies. He is a visiting faculty at Siena University and the scientific consultant for 2 European journals. He is the member of the Style Italiano group since 2008 and is the author of the quintessence book Layers in 2011 when he brought out the first edition, and Layers 2, which has come in 2021 as the second edition of the same book. He has several journal publications and is a world-famous invited speaker in aesthetic and operative dentistry. Today, he is going to talk to us about simplicity in advanced aesthetics, where he is going to show us how to achieve highly aesthetic restorations with direct composites by paying attention to precise shade matching, the right choice of composite material, and careful stratification techniques. Over to you, sir. We are eagerly awaiting your lecture.
So, to the organizing committee, thank you very much. I'm really honored. Thanks for the beautiful presentation. I have to say first that during our full lockdown in Italy, we were the most heated, the hot spot of the world for some months. And here there were really tons of people doing free webinars and free stuff, trying to sell some online courses, which I found completely out of ethics. So you probably have seen that during the full lockdown and stuff, I didn't do really anything, okay? So was trying to build up other stuff. Saying this, and now, because you're having now a difficult time, and I know how you guys are suffering, that's why I really decided to come here out of any kind of interest, out of really admiration and compassion to you, because I know what you're going through. I hope this helps to grow, to learn, to be a little bit more calm. I hope I can give you some insights. Really, I care a lot, no matter who we are, which language we speak, which color of the skin we have, which beliefs we have. We are all a loving community, and we must help each other. My way of helping today, it's bringing up the message we've been doing for several years. And you see here, I want to introduce my wife, which it's half of what I do in everything I do, always with her, and the logo of my group, Style Italiano group, which they are really an amazing set of people. Sorry. Everything we see, everything we can see in these slides, everything starts and ends up here. It's my group, it's my people, they're my brothers and my fathers and everything. So never been prouder of doing something like that. And this is Layers, what we built in 2012. We wrote this book, and I never thought it was going to be so successful. It was actually translated in several languages. And this book nowadays keeps selling as it is. And we didn't make a second edition. We did a Layers 2. So this is a completely different book. It's a new book with everything inside, because one of the books, it is about concept and practice. The second, it's about clinic and application, and this really was a milestone. It will be out in November. Okay, today it's a very special day, because I am delivering all the digital files to the American editor, so they can start reviewing everything and start the printing process, which is a milestone. And what are one of the things we can learn from this book is how not to do this. And I've been struggling not how to do this since several years in my life. You see, since I started manipulating composites, using them in the clinic, I always have some difficulty, especially when switching brand. You get used to one brand, you know what to expect, you know what goes wrong, but then you take another brand and magically it works better or worse. There's no middle turn here. So here I'm showing you in these 8 syringes, 8 different syringes of A3 dentin. And look how all them 8 are incredibly different. So even if they say A3, how do you know it's an A3? You don't know which one is a true A3. And even if you know which one is a truer A3, does it make a lot of difference? The answer is no. It's very complicated. And since that time, I started ignoring what the shade guides told me, what the labels told me, because the name of the label, I could name anything I want. You can, and you see, you could put over pearl, frosty, high value, low value, medium value, A2, C3, C4. It means little to nothing. It's just like an appetizer, like starter for your color. So what we did as a group was playing with all of these composite syringes. So to try to see from the systems, I could make something similar to the Vita shade guide. This allowed me really to be a little bit more precise on my color matching, meaning I could make the color matching with the Vita shade guide in the mouth if it was somehow similar to, in this example, the A3. A3, it's one of the colors we use the most. If it was kind of similar, then I know I could rely on the recipe I had beforehand. Way better than relying on the name of a syringe. So what I'm telling you here is don't trust what's written on the syringe. Of course, it's a good approach. It's better than going completely blind, but not very different from going completely blind. That's why since 8 or 9 years, we have been using personalized shade guides. And these shade guides, which are built from the same composite and from the same syringe, we put it on the mouth, and they actually worked for us for several years, even though it required really much of your attention. As you see, that we can make some beautiful restorations. They can be a little bit more perfect. They always end up being perfect by your artistic skill, as you can see in this incisal edge, which is a little bit exaggerated, but help to achieve much more naturality. So, in short, I took a full system of composites. Imagine you have a composite with 30 syringe, 40 syringes, and then you make all the combinations from all the enamels, all the dentines, all the bodies, and get the best matches that you can see in the Vita shade guide. That's the A1, A2, A3, and A4. So I will be absolutely ready to match the color with my Vita shade guide, and then make a restoration according to this recipe. Which are the recipes? For example, I put this one as an example because it was the first one we did with the Filtex Supreme material more than 11 years ago. And we have all of these. We only made the A shades as they are usually the ones that match in most times. So we did it like that. Then from the personalized shade guide, the personalized shade guide has some calibrated thickness, meaning that my shade guide, the enamel layer on the shade guide measures 0.5. So I need an instrument that gives me 0.5 on the surface. How are we going to achieve this in a very simple way? So, which means I will put all the dentin. I'm not going to do like in the past, where I placed dentin in very small applications, and instead I'm going to put a big chunk of dentin and start just spreading. And with a spatula, with an instrument, with my modeling instrument, I'm just going to adapt it very well and get rid of the enormous excess. And I'm calling enormous because that's the thing. If you want to do one-shot things, then you need to remove the excess of things. Afterwards, I can place my instrument, the calibrated instrument, which is called misura. Misura in Italian means measure, and it will give me a beautiful space for the overlapping enamel. So I am creating the enamel space at the expense of the dentin. So I am passing this instrument to make room for the enamel, thanks to the dentin. If I am mistaken, I just take the brush, put it back, and calibrate again with this instrument. Some of you have seen it, some of you haven't. Okay, but it is a new kind of instrument that it's already on the market from 10 years, and it's really, really useful, especially if you are using this kind of recipes. So let's get to the real clinical cases. Okay, here I have one beautiful case. Just let me get you into context so you know all the difficulties, okay? Because I can show you this picture and say, yeah, okay, there are medium, small fractures, whatever. But imagine I have a full agenda today, okay? Just today, it's 4 o'clock in the evening. Maybe I have 3 or 4 patients left. And then suddenly, in the middle of the afternoon, a patient calls and they say, I broke my teeth, I need to come. And for us, broken anterior, it is true emergency. So we have to really put them in priority, okay? So at the end, they ended up squeezing this patient in the middle. So at least I can do something. I can seal the dentin. Every time I receive this kind of patients in my hands, I try to be the most empathic as I am. In the past, in this case, I would have taken an impression and leave this poor guy, scared and traumatized guy, for a full week in their house. And that's the more I see, the more it seems less fair to me. Okay, so instead, I'm trying to build it up immediately. If it comes good, good. If it's come bad, I will correct or do whatever. The thing is, I face these cases almost every time without the use of a wax up. And that's normal because the wax up needs, at least in the fastest hands, some hours. Okay, and I don't have them. So remember that I told you to check the shade with a personalized shade guide. So here we are. You take the shade guide, and in this way, you can do an approximation of what your stratification will be. But why I'm not so enthusiastic about the personalized shade guides? Because I love them, I use them for years, and they really give you an approximation, but they have a lot of mistakes as well. Meaning that why they failed, because it sounds like the perfect revolution, like the perfect solution. But look, this shade guide, first, it has not the exact same thickness as the other tooth. The other tooth, probably in the incisal, it's 0.9, and on the middle, it's 3 millimeters. On the neck, it's 6 millimeters. These shade guides tend to be a little different. Second of all, it doesn't have a neighbor tooth. This one doesn't have a neighbor tooth. Third, it doesn't have a gum. So they all change. So yeah, I rely on these shade guides a little because they are out of context. Okay, so being out of context, you will see the color slightly different. So after I choose this color, what do? I do a try-in. And you know, I've seen in many of your pictures, in many of the of social media posts, in many of the publications, people placing composite over the surface of the tooth, like in the button try-in. I've heard about the button try-in 25 years ago, since I was in dental school for the first years, and it as genial as it sounded, I never saw a real application on that. Instead, let me show you what I have been doing for the last 7 years. Okay, you can choose your color with whatever method you like, the Vita shade guide, the personalized shade guide, the buttons, whatever you like. But before starting, you have to do what I call the realistic try-in. What is a realistic try-in? It is to do a layering simulation here. Ooh, complicated. It sounds elaborated and cool. It is nothing but putting your finger and placing the two of the shades you more or less decided to use and polymerize them in the place. Okay, it looks something like this. So you see here, I used a tiny bit of dentin and a tiny bit of enamel, just to recreate perfectly the class 4. And this class 4 has enamel and dentin. The tooth is hydrated. The tooth is on perfect conditions. So this would be, with these two shades, this would be the worst case scenario. I can just take these two shades and already have a successful restoration. What can go wrong? Nothing. I will use these restorations, these colors, do a restoration, and even try to be a little bit more precise, which works amazingly. And let me show you more of these cases. So here it's a hyper contrasted picture with polarization, so I can see the mamelons and all the stuff. But what I really think it's important, it's how you're going to do your preparation. And every time I do a class 4, the thing I care the most about is the margin. Because the margin, you need really some blending area, meaning a small bevel. Okay, there are many proposals for these kind of margins, and there are a lot. There are more than 8 types, and but let me summarize them in mainly 3 of them. Okay, first, it is the no margin or butt joint margin, which is a completely straight margin. This one is the most resistant of them all. What happens? It is non-aesthetic at all. You will see the line of your fracture. No matter what you do, no matter which material you're using, maybe once in a lifetime you will win the lottery, the color will be more or less fine. So this is the strong margin, but the ugly one. Instead, this, and take my words just as temporary, this bevel was said to be very weak and very fragile. So since many years, people recommended to do a chamfer. So it has a blending area with a straight margin over it. So not to make the story very long, both chamfer and bevel more or less behave the same. Same blending area, same resistance. So I go for the simplest thing, the thing that is most easy to prepare and that preserves better the sound tooth structure. Look how much enamel I preserve doing a bevel. Look how little enamel I preserve when doing a chamfer, which is actually very difficult to do. So since already 12 or 13 years, I've been using exclusively chamfer. And exclusively bevel. And which kind of bevel? Not a short one, definitely not a short one, but not as well a very long one. The long one, yes, I love it. It hides everything, but it takes out a little bit more enamel than needed. So I only use it really when I couldn't do it on the first shot or second shot. Okay, so I always stay in this, like the medium short bevel, which is something like 2 millimeters. And it creates a nice blending area. It's easy to prepare. and preserves a lot of energy. For me, this is the winning strategy. In the clinic looks something like this, which is pretty conservative, has a nice blending area. Okay, so this is how my preparation looks like. It's a very simple preparation, nothing fancy, just be sure to polish it. And then we can start the etching. You see, my anatomical matrices are placed facing the other way around, meaning these matrices in this same position wouldn't be able to build up correctly for example, the mesial wall from here, because it's facing out. And why I put it facing out? Because it's very easy to etch and to bond, to see correctly, even up to the end of the margin. Okay, so you have an open cavity, more visibility. Then, of course, we will move the matrix in the other way around. For example, here I took it out. And now that I want to etch and bond, then yes, I'm going to place my matrices in a way they can build the anatomy of my proximal wall. As you can see here, I place the matrix to number 11, and now I can build the wall anatomically. Which kind of matrices do we use? So basically, I use posterior matrices, just not used horizontally, I use them vertically. They go all the way to the gingiva, and they normally provide a beautiful anatomy of the proximal. Very anatomical, with a very cheap matrix and no complications. No need for fancy matrices, no need for anything else, but just a simple posterior matrix. If you will ask me later which brand I use Polydentia. Okay, Polydentia, I've been developing with them several instruments and found their matrices to be the perfect ones. Are there alternatives? Yes, but just check that the curvature is not very aggressive. Otherwise, you will end up having troubles. So this is the perfect curvature. So once let me go back. I will build first the proximal walls. Why? Why don't you first the palatal wall? Very easily, I don't have a wax up. So try not to do the palatal wall without guidance. So what I do first, it is to build the proximal wall. I put a little bit of composite on the proximal and try to read the direction of the palatal wall and translate it into the composite wall, as you see here. See, I did the proximal wall, I tried to copy the buccal wall, tried to copy the palatal wall, same direction. So this small structure, this poor little structure, it's very precise and helps me to position my finger as a palatal index. And you know, many of you can say, oh yeah, my father used to do this index with the finger, and as well my grandfather did. So of course, nothing new, we have all been doing this. But just to add something really rich to this rule, it is, if you build up your proximal wall first, then you have a room for supporting your matrix, which is amazing. So you will end up not having this kind of problems, like pressing too much with the finger or inclinating too much your finger, or both. A lot of inclination, a lot of pressure, you will end up with practically a void restoration on the palatal and very thin restoration overall. Okay, as on the same time, you don't want to put your finger too far away. Otherwise, you're going to get massive excess on the palatal and your occlusion will be enormously high. Okay, I think both problems are not really a problem, but if you achieve this, the very small excess defect, you will be able to have almost a perfect palatal wall. And let me show you how it's done. It's just like this. You did your proximal wall, then you put your finger index, not index finger, the finger index, okay? This word game. So it looks something like this. So I have my proximal, perfect, not perfect. My palatal, perfect, not perfect. And that's exactly what the next movement we do, which is with a slow speed diamond burr. I'm going to correct anything I need. The flakes of composite that were outside, the inside of the cavity, I can mill, I can correct anything I want until I leave this perfect. Okay, many of you ask me, oh, really? Can I touch composite in the middle of the procedure? Yes. And what about the contamination? Of course, there's contamination. But if you want to avoid the bad contamination, just don't put water or oil or alcohol or anything. Just do it dry. And you're going to remove the contaminants of the white powder, because you can see there in the screen, there's white powder all over. You're just going to put a little bit of bonding resin, okay? The moment you put bonding resin, everything disappears. And the only thing you need to do now, it's not polymerize, but blow air consistently, hard, okay? This moment, everything is going to disappear, and then you can keep up with your restoration, which in my case was denting and calibrate. You can do it this way, or depends if you're doing just a single shape, just to put the single shape. So now I can do my dentinal core, and I did it here, and it looks weird, really weird, because that's what you wouldn't expect from an expert dentist, perhaps. That Manauta, we can see your restoration. We can see how this restoration is way darker than what we expected, blah, blah, blah. I can agree with you. I don't feel that now in this context, they are the same. And of course, this is one of the first things you're going to learn with the experience and with the study of materials. And of course, as some of my best teachers told me, to cover your nose and swallow the pill, meaning stay with the colors you chose until the end of the treatment, okay? Don't improvise. Improvising it's for the people that want to fail. You don't improvise. So instead of now thinking, okay, I'm going to change the restoration, or I'm going to get a high value enamel or whatever, probably you don't need any of this, okay? Just if you chose the colors at the beginning, like this was an A3.5 dentin and an A2 enamel, just stay with that and don't worry. So I finished the restorations, pretty, not pretty, whatever. I don't care about that. I need to give a perfect shape. And in this way, if the colors are good, everything's good. If the colors are bad, we don't know that everything will be good. So keep with your first choice and don't move from there. We're going to review now in some minutes how to do the shaping, okay? Incisal edge, incisal angles, proximal walls, transitional line angles, surface texture, pre-finishing, and hypergloss. Okay, I'm going to show you which bursts, which speeds, which everything. I'm going to show everything so you can get this. And at this moment, many people panic and say, wow, what's the patient going to say? Patients don't say anything, especially if you, at the beginning of the treatment, told them, so I'm going to do this fracture or this diastema or this veneer, and at the end of the treatment, it might not integrate completely. You need to have patience and review after 1 week. This is exactly what I told this patient. When you warn them that before the treatment, and then you finish the treatment, and there's something different, first they say, yeah, it's not that much. That's the first thing they say. Second, they look up to you and say, wow, you're such experience. You know your stuff really well. And yeah, we should know this. This is our daily bread. So it's nice to see how your patients cope with you. Now, let me show you what happened 1 week after, because this just, for me, this is a failure. But 1 week later, it's all the opposite than a failure. Of course, it's not the restoration of my life or good competition in any Facebook group or whatever. Okay, there are way more skilled people than me, than this case. But the result, it's simply astonishing. It is integrating very good. We did quite a nice adding of the material in both teeth. Patient was extremely happy. And let me show you how it works even in bigger cases as this one. So I take my color, I use that recipe. That recipe can be 1 shade or 2 shades, it doesn't matter. The thing is that you know how to choose it. In this case, from the A3 of the Vita shade guide, I took the A3 from my composites, the most similar to the A3 Vita, okay? So I started using, I started the treatment with a very nice rubber dam, removing all the restorations, getting rid of all the old material, and as I told you, placing the matrices the other way around. So I can have perfect access to these areas. If I put the matrices already in an anatomical way to build up our proximal restorations, you're going to have a bad time. Maybe you're not going to see that you have a lot of excess in the proximal areas. Maybe you will not know if you really were able to etch up there. Instead, if the matrices are placed like this, you can see everything. And so it was. So I put my etching, I put my bonding, and I put really, really good polymerization. So afterwards, we start the build-up stage. In this case, I decided to use a single shade A3 body. This A3 body corresponds with my A3 Vita. This is not true for other brands. Other brands, maybe you have the A3 and you have to go darker to have a match, or the opposite, you have to go lighter to have a match. So just please verify that your A3 actually looks like an A3. And is this good? Not necessarily. Is this bad? Not necessarily. The good thing is if your A3 Vita looks like Vita, and A3 composite looks like Vita, you're okay to go, okay? So as I told you in the case before, you build the proximal walls. You can get help with a matrix, or you can do it here by a free hand, as I did, and then put a layering, final layer of composite, as I did here. I did 2 walls and then 1 layer of composite. The same thing I'm going to do here. So I'm going to put a matrix on the mesial, build the proximal wall in exactly the same way as I told you before, copying the palatal as best as possible, copying the buccal as best as possible, and the same for the distal. Once you get these 2 structures, which are going to fall into place because you're copying the palatal, then you can place your finger. And this is exactly what I did. Are not, of course, the most refined proximal walls you have seen in your life. And it's okay. It's normal. Why? Because using only 1 single shade, I don't need to take care about the thickness. I can do them rather thick and it doesn't matter. It's just the same shape. So now what I have to do is to place a complete increment of composite in the bottle. And there I go. I just place it like this. So it looks familiar to you to have some of the layering composites, and that you see them at the end and you say, yeah, they're not, it's not a big deal. They're ugly. And I agree, they're ugly. Why? Because they need really nice shaping. They have to have a nice shape, and this is not a nice shape. So not to make the story very long, just take your disc and start doing the incisal, the angles, the proximals. And after the proximals, then you can start to do your texture and anatomy and whatever you want. Okay, and this should be somehow easy to do. Okay, I'm going to show you step by step immediately. But if you have a precise way of modeling, this way with only one shape, and then the polishing will be extremely easy. I use, for pre-finishing, I use an abrasive rubber, used doing strokes, small strokes, touch and go movements, until I am there like 40 seconds, 1 minute, just to remove the scratches of the burr, and then use a paste with a diamond paste with a felt wheel, which gives me something similar to this. A very nice surface, all the morphology, all the texture, everything. You can see the shining from the side. You can see as actually many of the scratches we left on purpose, some of them not in purpose, but you can see how the overall shine, gloss, and life of the restoration, it's there. So this is as well what I want you to understand. How can you transform some ugly stuff like this into some beautiful restorations, which took roughly a little bit more than 1 hour. Okay, so it's three complicated restorations in roughly 1 hour to see how it's on day one, how they are 3 years later. That you see here, we have a misadaptation of my buccal layer to the proximal. So pay attention as well to that. We need good instruments, we need good vision, we need good lining so you can see. So morphology, it's not who knows the most and who knows most of the terms or whatever, because actually these terms for me, of course, I understand each of them. Each one of them have a meaning to me, but they have very little clinical application. If it's not only for communication between colleagues, for me, these kind of restorations, these kind of terms and complicated schemes make me always really be in a big question mark. Okay, so I prefer to go in something simpler like this, like dividing the anatomy into easy things. Okay, like numbers. Here you have that I divided them in 0, 1, 2, and 3. And everyone has its meaning. First, the 0, which is the basic anatomy. And you see the red line? That's the contour of the tooth. And that contour, you obtain it by modeling, and you modify it with discs. That's it. Sometimes, of course, with a little abrasive strip on the cervical areas, but not so much even, okay? So the basic anatomy is just copying the borderline of the tooth. And you can practice, you can draw, you can mill, you can do whatever you want. But the important thing is starting from the incisal length, then incisal angles, and finally, incisal spikes. Okay, so length, angles, and decoration. Okay, the incisal spikes, or these small defects that you have in the incisal, they are called incisal spikes. The essential materials we're going to use, it's of course a disc. If you need to remove a lot of excess, you need the red disc, the coarse one. If you have not a lot of excess, just use a tiny bit of disc, of this medium fine disc, that's it. And of course, for the cervical, use a diamond strip. Okay. Don't use the polishing strips. Polishing strips are for polishing. Finishing strips are for really removing material. So that would be mainly it. Instead, on the primary anatomy, which is anatomy number 1, they are the red lines here in the border of the tooth. And these are called transitional line angles. And these create a transition from the buccal to the proximal. And that area where the buccal and the proximal turn into something different, that's a transition. And that's where the light bounces. That's, if I take a picture, the light will shine probably there. As you can see in these pictures, with only one tooth shape, but different angles, I can do anything I like. As well, with the same tooth, I can make the tooth look narrower, medium, or wider. This is the same tooth, just drawing lines over it, you can do that, it looks completely different. Why? Because everything that is outside the transitional line angle looks a little bit darker to our eyes. Everything that is inside those angles looks a little bit lighter. And that's why a tooth of the same size, but with different transitional line angles, it can look of different size. And this we can play to our advantage. What are you going to do? Use the essential materials as well. You will use for this, of course, the disc, if possible, this medium coarse disc. Try not to use a coarse one, because with the coarse one, you might have problems. It's very, very aggressive. And I try to avoid it unless I'm in trouble, like having to remove tons of excess. And then there is the burr. How do you use them? So the disc, you use it from the outside to the inside to pull the line to the inside. Instead, the burr, you use it horizontally to push the line outside. And in this way, you have both movements, okay? Normally, I go almost 100% with disc. I don't need to push lines outside. Maybe for experience, maybe because I practice a little bit more, but it will happen the same to you, that this movement, you don't have to use it. Then the secondary anatomy, which are these sharp lines you see running from the incisal edge to the middle third of the tooth. These are called secondary anatomy because they are depressions that appear in the buccal area of the tooth, and you can see them actually in nearly any tooth. So if you put a tooth by one side, and it doesn't matter the illumination, because the illumination has to be moving, you will be able to detect that there are some depressions and some valleys and mountains, which if I highlight them here with a red line, you can see them. They have sharp and long shapes, especially those from the incisal, which look like a Christmas tree. Okay, it's a very sharp angle. Eiffel Tower, as a colleague of mine told it always. And this is done with two kinds of burrs. First, one, which is the rounded one for defining the shape, and then the diamond one, which many of you can recognize this kind of burr. It is a perioburr. That's what it is. And I love it because even though it has a coarse diamond structure, it is extremely delicate. And it's not because of the diamond, it is because of the low speed I use it with. You see, it has a latch type connection. So these are the essential materials for the secondary anatomy. One for marking, one for smoothening. Okay, so if you go from side to side, if you draw first your lines, you go deep, and then you smoothen them with the periobur. What you have to do is that these two aggressive lines that you draw with the burr, then you have to make them not disappear, but make the transition disappear. You will see later on how we do it. So finally, last but not least, the tertiary anatomy. With this tertiary anatomy, you can do magic. Okay, it's always, of course, on third place. It means the less important. But if you can reproduce these beautiful things, this beautiful perikymata, of course, it will be the best. This is how what I do on my anterior restorations, on my extraoral exercises. This is for me as best as I get, which are very parallel and winding lines, very near to each other and very well polished. So this is the way we want to imitate the nature, as here in this electronic microscope image. Someday, probably, we will have a burr, ultrasonic device, or something that will let us do as the beauty of the nature. How we do nowadays, I mean, if I want really big lines, I go with the tip of the burr from side to side, just like drawing with a pencil, back and forth, back and forth, back and forth. Instead, if I want like really micro texture, I go from clockwise, from left to, from counterclockwise, from left to right, scratching with the body of this burr. It will leave all the texture from the diamond. So these are the essential materials I use. I use the burr to draw the lines, the spiral wheel to smoothen them, okay, to make them less aggressive. And it happens like this. I do the lines. I since many years, I don't draw them with a pencil. It just stains my composite, so I don't like it. But this, for didactical purpose, I use it. So I draw them with my burr, and then polish with the paste and with the felt wheels. Okay, so here you have this silver powder. It is just a laboratory thing to highlight the texture, to see that not only the teeth are incredibly shiny, as you can see here, but they're incredibly texturized. But a texturized tooth can be shiny as well, and we want everything in the mouth shiny. A question I get often is, what happens if the rest of my teeth don't shine? How do I have to do my restoration? You have to do it shiny. But if the other teeth are not shiny, shine them. Okay, you want everything shiny. It gets less play. They are more beautiful. You get the concept, right? So for the polishing stage, okay, we do the following. We do just one abrasive rubber, delicate one, so you can preserve your tertiary anatomy. This is the soft flex spiral from 3M. There are other alternatives. You have to find your best one. For me, this is the one, which I use it with some drops of water. And then these kind of felt wheel, which are disposable, because actually the felt, it's very cheap. What it's expensive is the paste, but the paste, you just need to put a micro dose. Okay, it's incredibly small, so 2 gram tube, it lasts for many applications. This is the felt wheel I use, and I am the proud co-author of this, together with the group Style Italiano, where we put 70 felts for a 2 gram paste. So you can use really make a lot of polishing in just a kit, which is not even very expensive. So now that I extended myself for somehow 5 minutes, just let me start the end of this small webinar by showing you how I do in the reality. This is of course a model, but in realistic time, my finishing and polishing. And you see, this is stratified class 4, medium, large. And how I do, I always start with the length of the central, and then I go little by little to the incisal angles, and then afterwards to the transitional line angles. So basic anatomy and primary anatomy, they're both somehow linked, at least linked to the same instrument. And the instrument, I can put it from the mandrel upside and downside and downwards. So here, for example, I am creating the incisal spikes, which are the irregularities you can see perfectly in the other tooth. I try to go 45 degrees, which it's the same inclination I use for the incisal angles, and start just trying to reproduce this. It's up to you on how precise or how magnificent you want to be, okay? So I normally go 45 degrees and try to copy, okay? Not ruining my life with this or spending a lot of precious time, okay? So once I got this, I go to refinish correctly the transition line angles, because they really play a very good role. I don't paint with pencil. If you see what I'm doing here, it's I'm working with no water, and this is not a chance. This is on purpose, because I really want to see what is happening here on the transition line angle. If I get white powder on my restoration, I really need to remove that white powder. So it's like a detector, a surface detector. So I will start getting dust here, and I will try to scratch. Here for the spikes, you saw I used a scalpel blade, number 11, just to make them even sharper, like more dramatic, more critical, then refine them with the disc. And then I just, after finishing the cervical, I can start with my secondary anatomy. So you see, already with the disc, I redefine these transition line angles. And now I have to do the secondary anatomy, but not touching the margin, because here the margin, it is extremely delicate, because here I have my both tooth and composite, they meet at one point and you don't look it very correctly. So here it's a rounded burr I told you about before, and I start to do my secondary anatomy by drawing two Christmas trees. You see, I am defining the shape and the depth of these two depressions. Bad news, anything I do here with this kind of burr or similar, it doesn't have to be this burr precisely, I will remove the powder and they will look very ugly. Now I'm trying to get the same depth as in the other two. But look what happens when I remove the powder. They suck. Sorry for my word. They're not good. When you see it from the front, you see I just did two ugly lines. And that's it, two ugly lines. Because then after defining the depth and the shape, what I have to do is to eliminate that transition between the flat tooth and the too aggressive secondary anatomy. So I will take my diamond burr that I used earlier, and I'm going in the middle of this depression and go back and forth, smoothening the transition back and forth, back and forth, back and forth, several times. No water, so I see what I'm doing. The powder allows me to see, unveil a lot of secrets, And then when I feel that the powder is not letting me see very well what I'm doing, I just take my finger pass it to the surface. Yes, like that. So I'm going to start seeing better, okay? If it's enough, if it's not enough. Here, for example, thanks to the white powder, I see a little defect, which I will be touching. Okay, not to make the story very long, there is, after correcting everything that I can see with and without the powder, these two views are amazing, I need a third view. I need, how will it look when it's polished? And this, it's extremely easy to do by putting a little bit of bonding on the surface or saliva of the patient. It's better the bonding because it holds better. So I put a little bit of bonding and I can see a preview of the gloss. Yeah, this is only a preview. It has absolutely no other use than to see if your secondary and tertiary anatomy are beautiful. If they are beautiful, if you don't need to correct anything else, you can start the polishing stage. Okay, so here I start, sorry, I skipped the spiral wheel. So I put drops of water with my syringe, okay, and start smoothening. When everything's smooth, because it's up to a minute and we don't have now 1 minute, I do my polishing with this paste. This paste is called Lucida, and Lucida, it is, as I show you, the disposable felt wheel with this amazing paste. This paste, you use such a small amount, it stays on the tooth always, so it keeps working. But the beautiful thing is the moment you put a little bit of water, here we're working dry, the moment you put water, you wash away the paste. And after you're done polishing and you dry everything completely, look how this shiny goes amazing. Okay. So it is the same protocol I use for every case. And of course, the last message I want to tell you is if you cannot beat them, join them. In which sense? Look at these two restorations. I've always been a dreamer and I always try to make the most perfect. But if you start doing these restorations and just think that you have only to integrate the margins, you're kind of lost. For example, this tooth, we have to remove a lot of composite from the buccal. This tooth, we have to provide this tooth some more volume. So the moment I remove the restorations, I see that here I have to, here I have to really make practically the restoration up to here. And in this tooth, which is backward, I have to put a lot of composite on the buccal. So many times I end up veneering the teeth to make them a little stronger, to make them more aesthetic, and not to have to worry about integrating just a simple class 3, which is very difficult, or a simple class 4, and then end up with two very weakened teeth with margins. Okay, do you understand why I put material? And I put them with this beautiful matrix designed by myself and with the help of my team called Unica matrix. And this is really something out of the extraordinary. Just to say as well that all of this modeling, pretty or not pretty, was done with only one instrument, which is called solo anterior. And you see, when I finish, you say, it's ugly, the color is ugly. And as I tell you always, stop thinking about the color immediately after removing the rubber dam, because once you remove the rubber dam, the color is perfect if you tried correctly the color. Just for finishing, and that's the last 3 slides I'm going to show, anyone can do this, and it requires only practice. And just what I told you here, you can do it with practice in outside the mouth, any kind of composite, you can try to polish it. And if not, ask this guy, a colleague from Pakistan, which I've been educating him for the last 3 years. And as you can see from exercise number 1, which it's really something very ugly, until exercise number 100 or 200, I don't remember, which it's already doing like a perfect texture. So it's reachable, it's up to you. Actually, in a couple of months, we're going to release this practice on how to do this finishing and polishing online. So you will be able to purchase, you will receive the full kit at home, and you can follow this training online. So final message, and it's one of my favorite quotes by Steve Cowley, that it's not true that we need more resources. What we need is more knowledge. So in other words, with just one burr and just one disc, we can make magic. And with this, my beautiful friends from Bangalore, I wish you a quick recovery from the pandemics. I wish you to be extremely responsible with going out, with taking your vaccines, with protecting your elder ones, protecting the weak people. I wish you are a lot of solidarity with the people that need your help, and that this shit goes away very, very soon. So, Ashwin, I give you the word just to say thank you and goodbye.
Thank you.
I hope you enjoy and learned a lot.
Thank you so much, sir. It was a wonderful presentation. Above all, thank you so much for coming to this platform and enlightening us with your words on this topic in this tough time. We can't thank you enough. Thank you so much.
No, it's perfect for me. So if you want, we'll do some of the questions. I didn't even...
Yes.
Thank you. Thank you for this.
Yes,
please send it to me via email.
Yes, sir.
It means much to me.
Yes, sir. The team would like to present you with an e-certificate to express our humble gratitude. The same will be emailed to you. Thank you, sir.
Thank you. Thank you. So please use this knowledge responsibly, and place them in your heart, because that's where they come from mine. So let's answer a couple of questions, which says, do we give a bevel in order to mask the demarcation margin between composite and full structure? Do we provide straight bevel or a sunburst bevel? So no, you do a straight bevel. Okay, what you need is a transition area to hide your composite. I do it straight, 45 millimeters. The sunburst, I tried it, but it's highly unpredictable. You don't know then where to close your margin. So we prefer just a bevel, 45 degrees, 2 millimeters. Another question I have, it's what is the speed which you use the spirals? And it's near to 10,000 revolutions per minute, but it's not much about the speed, which has to be moderately medium high, but this movement, coronal to apical, cervical to apical, cervical to incisal, several times, touching all movements. Okay, so they're delicate strokes, because if you stay on the surface, it takes less than a second to raise the temperature and put your tooth at risk. Okay, another question is, what is the burr size and number used for creating secondary features? So it is a burr, a number 4 burr, and it's red coded. It means it has 18 blades, but you can use any old burr you like. Okay, I have no financial interest, but we did a kit with Comet. It's called Finishing Style, and there you have all the burrs there. So there you go. For example, if you go to our website, then you can see the codes, the ISO codes, buy from another model from another company. As I told you, there's no financial interest. Another question. It's brilliant. Thanks to you. Thanks for presentation. Another question. Do you prefer an infinite bevel? So between all the bevels, of course, infinite bevel was the longest one. No, I don't prefer it, but many times it's extremely convenient, especially if you have made 1-2 corrections, you still see the line go infinite, which is kind of a partial veneer or almost full veneer, as long as you preserve the enamel. So what we want to do, yeah, you can prep, you can do these smooth transitions as long as you don't lose your enamel. What is your take on Omni Chroma composite from Tokuyama? They claim one shade for all teeth. And my experience is, yes, they are good as long as they have substrate to copy. Meaning, okay, these kind of composites are, yeah, they're mimetic. Okay, as well, the word mimetic doesn't exist in dentistry. We have to be correct, but they have some kind of lateral light incoming, and yeah, they adapt to their surrounding color. If they have little place to take color from, they don't work. Instead, for example, if you're doing a purely additive increment, it will work. If you are doing a class 3, yeah, it will work. Okay, so that's my position on Omni Chroma and similar composites claiming to have to be universal one shade. If they have substrate copy, they work very, very well. Another question I have: aluminum paste for polishing. I don't use aluminum paste for polishing since at least 9 years. Why? First, because it is toxic. Second, because it's tremendously painful to remove them with water because it has some kind of wax inside, so it's really difficult to polish. I use a diamond paste. It's completely hydrosoluble. I designed it myself together with the Style Italiano team and the dia sharing company, and it's called Lucida with a C, Lucida, Lucida, which means shiny in Italian. And it's really, really easy to use. You just use a tiny, tiny bit. It shines like crazy. Water goes away. No rival. I know that together with Diashine, we designed the best diamond paste in the world. So no problem. Thanks to all of you. As I told you, stay safe. Take care of your loved ones, even the ones you don't love. But now we have to take care of each one of everyone.
Thank you so much, Dr. Jordi. It was simply brilliant and marvelous. You are really gifted, and it was the time we did not even realize that 1 hour was over. By the time we saw the end of your presentation, we didn't realize time flying. It was really amazing. You're truly gifted, and you made it so simple. You made it seem so simple. I hope we would be able to, practice whatever you have taught us today and achieve great standards like you. Thank you, and thank you.
Thank you
for your concern about India. Slowly we are recovering from the pandemic, and I'm sure in days to come we are going to be out of it, and we will also stay safe and careful in future. Thank you once again.
Thank you, Dr.
Forza.
Jordi.
Forza India.
Yeah, thank you, Jordi. That was very excellent. And I think you made the most complex restoration look very easy. And I think that is a mark of a great teacher. And I have had people tell me that composites listen to your hand in India. So, I hope we can achieve, and it's been an inspiration for all our students, postgraduate, almost 180 of them. And special thanks to Ashwini. You want to put in a word? You're free now to end it. I think that's fine. Okay, Dr.
We hope to have you in future, Dr. Jordi. We hope to have many more collaborations with you. Thank you once again. We are really grateful to you for, sharing your valuable time with us. I know you're very busy. You have a very hectic schedule, but despite that, you have taken time off to be with us today. It's been a very fruitful session for us today.
Thank you.
Thank you. Thank you, guys. Take a lot of care, really.
Dr. Jordi, thank you so much. Thank you so much,
Thanks
Dr. Jordi. Yeah.
Thank you. Thank you. Have a nice evening.
You
Take
too,
a lot of care.
Bye. Bye.
You too.
Yes.
Bye.
Bye.
So the next lecture for all the participants, we have the next lecture coming in the coming week. We will be dropping the brochure and the poster accordingly. It is from the one more gifted, great master technician, and that's somebody, I mean, you guys have to make sure you attend. He's brilliant. Dr. Jordi is also extremely brilliant. We've been very fortunate that both these esteemed and, I mean, huge guys, personalities have agreed to do pro bono lectures for us at a time when we are in lockdown. So I would appreciate all of you to come on time and make the best use of it. Thank you for this immense support. I mean, there was already 190 registrations and it was fantastic. Thank you all. I hope you enjoyed it. We have one more lecture to go, and that brings the finale of the masterclass series. So please log in to the finale also. We have a surprise for you. So thank you. Signing off from BITS. Bye.
Yeah, thank you. Thank you for your patience for coming back again today. Because of the time difference, we had a problem initially. But thank you all for staying on with us and staying till the end of this session. Thank you.